Today on the Forgiven Nutritionist podcast, I had the pleasure to talk with Dr. Balci from Mayo Clinics. Originally from Turkey, Dr. Balci is a psychiatrist that received a scholarship to study abroad in Milan, Italy. She then completed her residency at the esteemed Mayo Clinic, where she also taught for 5 years, followed by a fellowship training in behavioral neurology and neuro-psychiatry. She is also board certified in lifestyle medicine. She is now at Mayo Clinics, where she adopts a whole person approach and helps people identify the factors that affect their well-being. We had a wonderful discussion about overall health, and she compares the body to a vehicle, and you are the driver. She suggests that we focus on nurturing ourselves for overall health. Here's a clip from today's show.
This is solid medical scientific literature built up over the years that we have 6 pillars. What are those? Nutrition, exercise, sleep. Everybody knows that, but it is important to see that it is confirmed, along with stress management, substance use, social connection. So one do think that it all makes sense, but the thing is that common sense is not common practice, right?
Hey everyone, just a quick break to show some gratitude to our sponsors and give you some special deals. If you are looking for a trustworthy place to choose all of your supplements, FullScript has 285 different brands to choose from. They did the work for you to check quality standards for all the supplements they carry. These standards are important because they help to ensure a product is safe, effective, and accurately labeled. FullScript uses third-party companies to provide unbiased assurance that certain quality criteria are met when they add a company or product to their inventory. When you set up an account with FullScript, use my link and you'll always get 15% off your supplements. Good morning. Today we'll be talking about the 6 pillars of medicine, and definitely talking a lot about the brain and depression. So why don't you tell my listeners how you ended up doing what you're doing, and also how you ended up at Mayo Clinics.
I kind of projected upcoming 50 years planning for my life. So I said it should be psychiatry and United States, where the pioneers are. So I will go to the United States. So that's how I came to the United States and how I ended in psychiatry. So I started my residency at Georgetown University, then transferred to Mayo Clinic, and fantastic places, great mentors. And I was about to graduate. I realized I don't know much about the brain, and what I really wanted to do was not happening. I really didn't understand what was happening, that our psychiatric visits were reduced to 15 minutes med checks, the med check, and I said, it is all I am. Then I got into fellowship, so I decided that I need to learn more about the brain. So I did a fellowship, 2 years fellowship at Mayo Clinic, Florida, in behavioral neurology and neuropsychiatry. There, behavioral neurology and neuropsychiatry is a very comprehensive field that it could go from, cognitive disorders to dementia, and we were seeing more dementia patients than behavioral functional patients. So that was not what I had in mind, but it helped me so much to deepen my knowledge, my expertise in brain diseases. Then I became faculty at the Mayo Clinic, started teaching as well, and it was really good, but I always had this, I need to do more, just, psychotherapy and medication management we ended up, but if the whole body is not overall healthy, how can the brain be healthy? And it was more, the orientation was disease than health. So I always thought that we should focus on health and trying to get healthy in every meaning of the word and find a purpose for the person, and all those will be byproduct as we are moving forward to a fulfilling, healthy life for my patients, people. So I wanted to show that, and in academia, so I was offered a position at the University of Minnesota, where great research scientists, clinician scientists were working on different aspects of this. I hope that we could do this together. My dream wasn't coming to fruition there, so I said, okay, who does what in the field? And I remember while I was a fellow at the Mayo Clinic, when I was sharing with the patient that, how limited we are in the field of psychiatry, that we are not even looking at the organ that we are treating, and this should be a whole comprehensive approach and for X, Y, and Z. And then the patient said, you sound a lot like this California psychiatrist, Dr. Amen. Do you know anything about it? That was a time I had never heard about Dr. Amen at the time. And I said, oh, this is great. Why we are not taught this during our education? But I really wanted to stay in academia and show that in academic language that this is how things should go. I believe academia will catch up. The thing is that for various of reasons that are out of the scope of this podcast, that things are much slower, and there's a lag between what's happening in the lab or experiment environment and what's happening clinically. Mm-hmm. So I decided that I will join the Amen family. So I sent my CV to Dr. Amen, and here I am.
That's wonderful. Yes. And I remember when I first heard years ago, Dr. Amen say that it's the only field where nobody looks at the organ that they're trying to treat. And that to me was revelation, a huge revelation. I never had thought about that because for years I had suffered with depression and anxiety, and it never once dawned on me either as a patient that why isn't the doctor trying to look at it? You just assume that they know certain things and you trust them, which is great, that you should always definitely trust your doctor. But at the same time, there's a lot of things that they can do, especially nowadays. Of course, 20 and 30 years ago, it wasn't the same but as it is today. But yeah, definitely looking at the brain is interesting. And we can definitely talk a little bit about that today, too.
Absolutely. The thing is that it is not that no psychiatrist is looking into the brain. They are at the academic and research settings. But it is not, again, the translation to clinical settings for various of reasons that are, again, is very complex and beyond the scope of this talk today, that there is a tremendous delay.
Mm-hmm. That's okay. I'm glad that there are people like you who are on board and willing to look and reach out, and hopefully other patients or clients or people that are out there that are listening to this podcast for the first time, maybe that'll spark a little interest with them too, to kind of think and take pause with their current treatment and maybe think, okay, what can I be doing more to maybe help myself and get my brain and heal my brain to get a little bit better as well.
The mind is directly linked to the organ is the brain. Then we need to start working from there. And there are different approaches, and there still are, even in the field. And amongst people that thinking mind is a completely separate issue than the brain. Mm-hmm. So in that regard, I'm more of a physicalist that cognition, the wonderful part of being a human, what makes us human, is a product of the brain. And now some of the scientists took it all the way to the extreme that everything is right here, right now, and it's all behavior. There is no such other things. Let's study this. So and the dance between psychiatry and neurology, whenever we found the reason for causality for whatever we are seeing, as soon as it became physical, neurologists claim it's more of a territorial realm there. So no wonder people think that mind is this abstract idea and there is no way to look into that. We're not looking into the mind, we're looking into the brain, the physical organ, output of which is the mind, behavior, feelings, and thoughts.
Yes, definitely. And one of my favorite things that you had said today, a couple things actually, is that people sometimes focus on the disease and not health. And I can tell you that for years, myself included, when I had suffered from depression and anxiety, I was given that diagnosis and I kind of just sank into it and accepted it. And I didn't ever think that there was change possible. Rather than focusing on possibly the health that I could have, I was focused on the disease that I was given. And so I kind of just accepted that for 35 or plus years. And, and then I finally decided to take my own health into control and take back some of the control that I had no idea that I had lost, and that's when I really started to change and everything. Because one of the other things you also mentioned is that how chronic disease can be reversed. And people don't really think about that. They, I think that when they're given a diagnosis, that they're stuck with it. And I'm not saying that everything can be reversed or everything can be drastically improved, but you've got to start somewhere, and you're going to be no worse off than you are now. And I'd rather help my clients and hope people reach out to people like you so they can find their own health and struggle going back to being healthy instead of stuck in their chronic disease and their illness, whatever the condition is.
Absolutely, absolutely. And it is not lack of education, I would say. It is lack of awareness and responsibility. I like that instead of responsibility, it's just like able to respond. Responsibility, not responsibility. We have a response here, but what is it? We need to rethink. So it's not something that I created, but I like playing around the words. It's very important. And the thing is that medicine, it kind of served both ends, Then when I say we, the doctors, okay, I tell you what to do. And the notion, don't forget, we are information and access to information has changed tremendously. We missed this part. And not long ago, internet just came to our lives. ChatGPT is completed. I am, anyone over 40 who, which I am, said, I remember the handheld phones, landlines, and getting in. So tremendous change.
Yes.
So, and now people have information, but practice states that we are creatures of habits, and doctors had that privileged access to information, kept doing things the way they were doing, and it was kind of convenient for the patient. Doctor, tell me what, it's always easier to follow directions than make your own decisions. It's true for all of us.
Yes, very true.
Does that make sense? It was kind of win-win in both ways. Now that there are, things are changing, people started making, taking ownership one's life, then deciding, recognizing who that person is and what they want out of this life makes a tremendous change in terms of healthcare in anything. We are living our lives as reactioners. Then once we started taking action, then we will ask ourselves, why would I do that? What is in it for me? But they were not asking. He said, doc says, go, even if I do these, do not do these, come back in 3 months and just following.
So why don't you tell us a little bit about the 6 pillars of lifestyle medicine? Because I think that might be a little bit eye-opening to some people too. There's some good action steps that they can take as well to taking back some of their own health. So why don't you go over some of those with us?
Absolutely. Lifestyle. So there are different branches of medicine. Lifestyle medicine after, whole this disease-oriented hospital and disease-oriented practice of hospital practice in hospital settings, disease-oriented medical practice. And we were like, with the revenue generation, doctors have been burned out. And we got into medicine, most of us. I don't to help and heal people, but what we ended up doing most recently, making people less sick for various of reasons that, again, beyond the scope of, but one thing that I could tell you, if you are healthy enough, the insurance company will not cover for XYZ. So those kind of things. If you don't have 10 plus or N plus diagnoses, then it won't cover. So lifestyle medicine, it's just cumulative medical literature, cumulative science knowledge that what helps people. And then 85 to 99, about 90% of chronic disease is proven to be able to reverse, treat and reverse by lifestyle interventions. And what are those? And this is solid medical scientific literature built up over the years that we have 6 pillars. What are those? Nutrition, exercise, sleep. Everybody knows that, but it is important to see that it is confirmed, along with stress management, substance use, social connection. So what do you think? That it all makes sense, but the thing is that common sense is not common practice.
Let's start with nutrition, since you mentioned that one first. That's, I think, sometimes what people automatically just jump to. And one of the things that I work with my clients, I study integrative nutrition. So that, again, is definitely the food on your plate. But it also encompasses many things that are very similar to the 6 pillars of lifestyle medicine, where it encompasses, social connections. What kind of home life do you have? Your spiritual health and financial health. It's more than just the food on your plate. It's all this other food as well. So tell us a little bit about what kind of foods do they recommend, or do you try to stick with and gear most people towards? And at the same token, what kind of foods do you try to steer people clear of, at least at the beginning?
What I wanted to point out, listening to you, maybe we can make a suggestion about, it shouldn't be nutrition, maybe nurture would be the word, as a non-native speaker, that I would recommend that, right? Nurture, because nurturing, not only chemical, biological nurturing, but social, spiritual, and spiritual, we can talk more of existential being, purpose nurturing, and social nurturing, right? I believe nurture, I would make a suggestion that nurture would be the word, and then it would cover it all, I believe. What do you think?
Oh, I love that. Yes. Yeah, I'm going to use that. I will give you credit for coming up with that.
Fantastic. I love that. and I'm a believer that, I'm a true believer in cumulative knowledge of humanity. Nobody does it. No man is an island. And that is fantastic, that I really love living this day and time that we are building up, and I'm facing tremendous knowledge, and we are all building up what has already been done. So like we are standing on the shoulders of giants. Actually, I always feel like we are standing on the shoulders of humanity. We are together in this. That's my spirituality, is that does one believe they partake in something greater than they are?
Yes.
And could be orchestrated by God, or higher power, or not, or just equality. For me, I'm an all welcomer, but it's just all in all, are we in this together or not? If we feel like we're partaking, that's a spirituality. Lifestyle medicine, that I'm board certified lifestyle medicine physician, and they're very particular because, again, lifestyle medicine practice is purely based on the most recent scientific data. And on that, whole food, obviously, but more plant-based, if actually full vegan is recommended. And we say eat a rainbow. All those antioxidant phenols and that kind. So that will be the approach. But what I've realized more and more, and we all know that, healthy fats, now added sugars, and then even
Right.
overall, I would love to share my personal experience, actually, how I got more and more interested. I've realized along the way that this is a sacred vehicle. I always say the human body is a sacred vehicle for our being. And I've realized along the way that I will seeing, people after a certain age using walkers, and how humanity changes, how we use our body is not aware of this fact, that how careless, if you will, along the way. But it's we're much more, at least I am, I don't know everyone, cautious with our cars, our vehicles that to which we have so many alternatives. And so realizing that we need to take a better care of it, and the sooner one recognizes that, the more time they have to build on. But earlier in life, we can put, however weight, not only, like weight being body weight, but whatever we put on, it's a younger vehicle, and it carries without much difficulty. But body keeps score, right? So
Yeah.
along the way, when we most need it, there comes the problems, chronic pain. And when you're in chronic pain, you cannot, when your body is not feeling comfortable, when the vehicle is not comfortable, and you're stuck in it, there is no full body transplantation possible as of now. How could your journey be comfortable, right? So my being psychiatrist is actually, along the way, I forgot to mention that I just did not want to be only the doctor to the vehicle, but I said somebody needs to talk with the driver too, the mind, so that not only the doctor to the vehicle and the driver, but that separation, it's okay if you're a surgeon that you focus on and you're very technical and wonderful. Thank you very much for our great surgeons, great friends that, you can focus on. You don't need to deal with the driver unless you're a neurosurgeon, then at the end you have to at least check with the driver if he's still there, he or she. But other than that, you can completely focus on, like in a vehicle, that focus on whatever the vehicle, the body was brought to you, and you're done. But if you are a doctor who would like to, it's just more of internist, that comfort of journey becomes important to you, and you are there with them throughout the journey, then you start thinking about it. So my personal experience with that as a medical doctor, and having had this eclectic background, having trained in 3 countries, multiple states, right? That I said I solid medical knowledge, and I was, I'm a former athlete, and I was doing my, regular, semi-regular exercising, that kind of thing, and I started gaining weight after my 30. I said slowly, and I was just saying, for me, I was eating healthy. I'm just, healthy fats, and then watching out my carbohydrate intake, that kind of thing. But slowly, just very insidious. I said, what is going on? And I realized that, again, how I am as a medical doctor inclined to, nobody taught me, basically. So as a medical doctor, I've never had good understanding of how much my body needs. It's like going back to vehicle analogy, that you have a car and you don't know what fills the tank.
Mm-hmm.
First, we need to start there. Then the quality. I believe we missed that part. We just overfill our tanks, basically. That's what I realized. And then thinking that, okay, I give it good quality fuel. Well, too much of a good thing may be a bad thing at times, right? At the
Yes.
times, I need to get to the bottom of this. But I was so busy with residency and everything, but at least I had that kind of awareness. You must have seen so many doctors who are struggling themselves with healthy life habits, correct?
Yes, definitely.
Absolutely. And the reason is that because we are trained in the disease. We are great in keeping people alive in the ICU by IV nutrition. We can calculate how much of this carbs, lipid, and what kind of solution that we need to start the IV running, and what would be the infusion speed. We're great at that. But when it comes to, hey, how much do I need? And what would be the quality? It wasn't there. So I just studied that, and actually a non-doctor friend of mine who was very into, healthy living said, hey guys, I did this, and this is how you calculate your overall daily caloric need. And if you'd like to make, 3,500 calorie equals to 1 pound. So if you wanna, so it's just, there's calculation basically.
Mm-hmm.
So until then, I was not watching that. And I realized that when I started watching, I every day, and again, guys, whomever the audience, I'm not asking you to be this disciplined from the get-go, but just know that it's just, we don't know what fills our tank.
Mm-hmm.
Our tank gets smaller as we grow older, but we eat more because we have more time and access to food, so it's a double down. Then we will talk about the quality of the fuel. But if you put bad fuel and too much of it, don't expect a comfortable journey, basically. So after doing, is that all right to give app names or something that changed my life actually, to start measuring and monitoring what I was doing.
Sure.
I use I just use the my Fitness Pal just to enter anything and everything that I put into my mouth. I weigh it and then put the calories and then certain macro, and that I would recommend more protein than carbs than fat, and the quality of it, like in the quality of it that we already, then we can talk about the quality. But first we need to hit those. Then about 8 weeks, I did not put anything without passport, like as an immigrant, like customs and border protection. Everything I put down, and that's how I learned, oh my goodness, what I was eating and what I was needing and the difference between that. So that's how I trained myself by practice. So I feel for everyone watching it out there, it's very difficult, and there are ways, and I would be more than happy to get into detail. And that's what I also offer to my patients as well when we come to that. But first, we need to start with why, the sense of why, and it shouldn't be aesthetical reasons or, more of externally oriented to please the whatever, but ourselves. I want a comfortable journey. And for a comfortable journey, the comfort of the vehicle that I'm stuck with, this body, it will be rate limiting. And out of those, the physical weight I'm carrying, one of the major component of that comfort. Is not that correct? So I start from there.
Definitely. And I think that a lot of people don't realize the things that we just go mindlessly through our day. And I've been guilty of this myself as well. We go mindlessly through our day.
We are not pointing fingers.
Yes.
We're
Yeah. So when you use things like My Fitness Pal, and I work with some of my clients too to kind of recognize some of the things that they do eat throughout the day, because it's easy to, before you know it, you've eaten a whole meal just while you're taste testing your food to see if it's good before it even hits the plate that you're actually going to sit down with your family to eat sometimes.
Absolutely. Again, like put a border protector here that anything gets in, tasting or not. I would just include that's again, but it's along the line. But what I would like to see that one thing that I believe I would like to mention that it's just brain is all or none thinker. We should just think about when people have pounds and pounds extra weight, they get demoralized, and then because it won't work, they feel like. I would like to tell you this, that first, do you want this to change? But not for, because my husband wants this, or, I would look more beautiful. It's just, it wants to have a really core reason. If we can talk about then, if that's the case, if one is committed to it, there will be a difference. Then but we need to start very slowly. It won't be an overnight journey, and depends on what we need. And if it is above a certain level, then there may be some extra medical and more invasive techniques. I'm not talking about those, but in general, within overweight to obese BMI of 30-35 ratio, we can talk about. But we start, what is the one little step that we can take toward that goal, instead of just, I need to lose this 50 pounds, whatever. So, but the brain the mind comes into role. That's really important. Who fools us the most in this life? We are the notorious fooler of ourselves. And then what happens that when we start, well, it won't work, taking, decreasing my portion or whatever that is, or walking 5 minutes, let's say, it won't work. It will take forever. It won't work. Because the brain, what wants to do is that that's inertia, that it's just all or nothing. So it's trying to fool you, your mind is trying to fool you to do nothing. Because you can do it all and you cannot lose this 50 pounds tomorrow, why bother? That is how the brain, it's just knowing the common frequently asked questions and common errors of the mind. Those are my thing. Like when we are just buying something, where we go to frequently asked questions and common errors. Let's learn from them. This is one of the most common errors that our mind, whenever we're trying to step toward a change, our mind will come that, well, it will take too long. Why bother?
I definitely believe that's the same with exercise too, not just food.
Any
Yes.
change, because change is difficult. Change means a direction, and then it's convenient to. I'm not saying that it's comfortable. I'm not saying that it's healthy. I'm saying that it's inertia. It is basic dynamics, by basic mechanics, that just staying where they are. We are creatures of habit and inertia. We don't want to change our direction. And mind works that way. Just recognizing that mind is trying to fool us into doing nothing, although incremental change, and there's a math to it. If you change one thing, 1% every day, it will be an exponential. It's a cumulative change. And there's math to that. Another time I can show you that it is exponential. There will be a tremendous gain. But what will mind separate it and dichotomize it, all or none? Since I cannot do it all, why bother keep eating as we are? But if we can just recognizing that this is a common error, and I just expecting that and trusting the process will make tremendous change, slowly but surely. Sustainability is the most important thing. We all know that diets won't work because sustainability is the key, right?
Yes. I definitely try to, when I'm talking with my clients, and I ask them, what do they want to eliminate from their diet? And then what do they want to add in? Because I want them to choose, because I want them to feel successful when they do then eliminate that from their diet and then add something beneficial in, for example. Because again, I can tell them this is not good for your health, or this is leading you down a path of destruction or not good. But again, we want them to not just take ownership of it, but I want them to have a long-term satisfaction with enjoying something new, possibly that they don't normally do, or removing something. And a lot of times they know what they should be removing, for example, from their diet and lifestyle.
Again, I'm telling that's it's not lack of knowledge. It's just what, and decision science is really important. That's our competitive needs. I need to do this, but this as well, and this is more fun and immediate, and it's right here, right now. Why bother to work on this tremendous goal will require a lot of effort while I can get this right here, right now, while I'm just this delicious cake is right next to me. Why bother?
Yes, and I definitely try to get from them what they feel like does not serve them or helps them in their current situation, whether it be arthritis or if they do want to lose weight. What is that one thing? I want them to choose the item that doesn't serve them anymore, and I want them to then pick something that is going to serve them to help them feel better and maybe remove some of that inflammation that they currently experience. So that's definitely good. So I would definitely want to touch on sleep before we have to wrap up, because I think sleep is very underrated, especially when it comes to brain health. Tell us a little bit, because I know that one thing I go over with my clients and people that I know is that I tell people that the brain needs to basically do a car wash when you sleep, and it's the only time it can do it. And you have to sleep a good solid amount of time for your brain to kind of go through this car wash. So if you could kind of touch on that a little bit and what the brain does when you sleep, or why sleep is so important, that would be great.
Wonderful. I like the car wash analogy, and it goes in line with the vehicle, the car that we've been talking about. So that's a good. It's a car wash. The car wash happens all the time, but most, just they're just maintenance issues that it's more garbage cleaners will come, and if we are not sleeping well, and then those are dementia, for instance, and they're called neurodegenerative disorders, like degeneration, neuronal degeneration, basically, that certain proteins will come and sit on important parts of the brain, and that's what's leading to dementia. So we need those clearing up, and there are so many studies showing linking sleep disorders to dementia. And also memory formation. We need that. Believe me, I was always on the go, and I hope that, hey, why do we need this? And particularly today's production-oriented, result-oriented life, society said, okay, what are we cutting from? We don't cut from our Netflix time. We cut from the sleep, right? Mm-hmm. So it is. And it is like, then it becomes the car race, let's say. It's like the pit stop. You have to stop, and for at least certain time. This is really, really, really important. And sleep is a very delicate, complex structure that so many wonderful things happening during, again, car wash, as we saw, memory formation, and then solidation of healing, basically a lot of healing happening during sleep. But sleep is a very complex brain function, and so many people think that even in medicine it could be substituted by medications. Medications could put you under, can make you unconscious, a form of anesthesia. But sleep, as I always tell my patients, that sleep is like a snowflake formation. There is no medical pill substitution will give you that. So it's really important that natural sleep for your brain. So there is, again, big and bold, there is no sleep medication, as the name indicates. There are medications that will put you under and make you unconscious, but sleep is a form that is very complex that cannot be delivered by medical interventions as of today. That's one thing, really important. And brains also, there are so many, again, the body, we need to take it as a unity. That's why functional medicine, looking into the core of the disease, not the cure, what's happening, going into root cause analysis, all those different systems functioning together in harmony, orchestrating, really important. That with sleep, basically checking our biological clock day and night, there are so many neurohormonal, the hormone changes and chemical balances, checks and balances happening during sleep, and being on a regular schedule is really important for the harmony and sustainability of this vehicle. Makes sense?
Definitely. Yes. Yes. And I know that a lot of times, if you don't sleep well, it can impact things like your blood sugar levels too, which people don't always put together. So it can definitely lead to type 2 diabetes.
Absolutely. That's what I was trying to, exactly that, try to explain it. At night with the all those hormonal checks, and there's a cortisone that would increase upon awakening, and it will change your blood sugar, and if your sleep is erratic, then cortisol levels and everything will be out of the way as well. Depression. What is depression? There are thousand roads to depression, like 1,000 roads to Rome, and all at the end the outcome may be the same, but as not all paths are the same, nor should the treatment or approach be. This is really important. And in psychiatry, again, there are many political and financial reasons for that. And I'm not a conspiracy theorist, but that we keep doing these things because, pill is easier, more convenient for our patients. Procedure is change your life is much more difficult than taking a pill. And
Yes.
even taking a pill, we can't do it on a regular basis. What's the compliance rate? Even one pill. So it's difficult. That's why I wanted to share why change is difficult. And I would like to actually educate people more on common errors of the mind, so that at least people recognize. Does that make sense?
Oh,
So
absolutely.
So in terms of depression is like, depression should be considered as a symptom, not a disease itself. It's like saying you have chest pain. And Dr. Amen talked about it so many times, but I'd like to reiterate here as well that there are so many causes for chest pain. There's so many causes for depression. Not every depression is the same, nor should the treatment or approach be. So this
Definitely.
is really same as for anxiety. So this is really important. And in terms of diagnosis, how we are diagnosed, it's called halo effect. Patients are taking the approach and pill to cause treatment approaches. Just starts from more infections that we had. What was making humanity suffer most up until 500 years ago, actually even today, infections, right?
Yes.
Well, infections are most of the time one causal agent. You name the bug, you get an antibiotic, you are done. But you saw, even with COVID, here in this age, how much whole humanity, we struggled, correct?
Yes.
Getting
Yeah.
And we were much faster identifying the bug. Think about something like depression. There are so many causes, and the treatment's anti-cause, depression, anti-depression, that should be too many. But because it's so convenient to take that notion of bug, anti-bug, as if infection, because it saved the humanity basically, infectious disease approach, they take it this disease, the pill approach, and feel like that can be generalizable to every disease. No, it can only be generalizable when there is one cause and we can come up with an anti-cause. When the cause is so vast, then your approach should be as complex as the cause.
Yes.
Makes sense?
Yes, definitely. And unfortunately, I think that many patients, like myself at the time, I'm no longer on any depression or anxiety meds. I had come off a few years ago.
Yay!
After a lot of years, and I came off very slowly and very gradually because I had been on for so long, and I was not in any hurry to do it. I wanted to, but I think I was under the mentality, and I think a lot of people are, is that that's the only option we have, and I don't think that many people realize that there are other options. And we, like I said earlier, we're not stuck with that diagnosis that we've been giving. As long as, like you said, we get to the root cause and figure out why, what is causing these symptoms, then maybe we can reverse or fix the problem so you don't have to suffer anymore. And now I don't suffer. So, and those around me benefit a lot better than when I suffered for all of those years. So hopefully somebody else will learn from that as well.
Absolutely, absolutely, and that's why, psychiatry, any field that behavioral change is part of it, that can change generations. That because we are social learners, and while you're struggling, your loved ones and whomever your life is in contact, their lives struggle. But when you are learning and changing, we are social learners, and we start imitating and learning from each other, and those, it's just a network that ripple, that just it expands to health and healing. That's really important. But I want to say that there are some there are differences in severity, and sometimes I'm no shy and in using medications, and actually neuromodulation, magnetism, electricity, brain batteries, if you will, the DBS, VNS stuff. I'm no shy, and I have the knowledge, I have the practice, but this is really important that majority is not there. And it's not generalizable to everyone. This is really important, and what we are missing is the purpose part most of. Why would you do that? And okay, you are in a journey, you're the driver, this is the vehicle, but where are you going? Right? That's the spiritual part. When you don't know where you are going, why would you push the gas?
Mm-hmm. Definitely.
So that should be, and an Amen model, biopsychosocial and spiritual, that's the purpose part of it. And we need to have the sense of why, and that doesn't come in pill form.
No, it does not. But again, like you said, it requires a little more work, and people are afraid of the unknown, and I think it is easier just to take a medication. And like you said, some people may need it, but I definitely think that, and I know for me, it ended up causing some other side effects, and that's the thing that people don't realize too, is that side effects are real, no matter what the medication is.
And we start the medication for the side effect of the medication, then we start another medication for the side effect of medication that we started for the side effect to begin with, and it goes like that. Mm-hmm. And cui bono, who benefits at the end? You tell me.
Okay, so as we wrap up, I always like to ask my guests this question. So it's, what is your don't miss this moment from our talk today?
So it's just one thing that, human bodies being the vehicle that we are stuck with for the rest of our lives and comfort of our journey, depending upon the comfort of this vehicle. That will be, don't miss this moment, I guess.
I think I do really like that. When you phrase that, I think it's well said, and people can kind of relate and understand to that, because most people have a car or have had a car, so they kind of know a lot of the pitfalls, the blessings and curses that come along with owning a vehicle. And if you don't take it for regular oil changes, things are going to happen. If you don't get systems flushed every once in a while, things are going to happen, and you have to have the tires rotated. So it's like you said, it's the same with our body. We need to, it's our vehicle that we have, and we have to take care of it just like anything else. And so I like that. I like that.
Very important as well, and many, and particularly maybe women and Forrest, your vehicle can look great from outside. It doesn't mean that it is comfortable. Does that make sense? Very important. It may look thin, it may look beautiful, but doesn't make that journey comfortable or harmonious. This is important as well, and this is whole functioning and what the driver feels inside.
Yes.
And what the observer sees outside. These are different things, and and so many things that, where do you drive the car? What is the climate? Who are you driving it with, right?
Yes, definitely. Well, thank you so much for being on my podcast today and taking time out of your busy schedule to do it. And I'm sure that my listeners will get a lot of information from you, and I'll put some links to where they can see you in the show notes. And so thank you very much for being on. And
this was delightful. This is my passion. I could talk more, and again, I would like to, I'm here to help change lives and make this world a better place for all of us, and that's my purpose.
Hopefully I can have you again on someday.
I would love to. Let's do it.
Okay, great. Pendulum has probiotics that will help heal your gut. Their lineup includes Akkermansia, Metabolic Daily, and one called Glucose Control, which is great for anyone wanting to improve their blood sugar levels, and you don't have to be a diabetic to take it. Any of these 3 probiotics include an important strain of probiotic called Akkermansia, which is only sold by Pendulum and is a key component of strengthening your gut lining and gut health. All of their products are clinically studied and third-party tested for quality. Check out all of their products at pendulumlife.com/discount/forgiven, or click the link in the show notes. Use code FORGIVEN for 20% off your first month membership. If you want to continue learning and hearing all things nutrition for your mind, body, and spirit, click like, subscribe, or favorite me on whatever podcast platform you use. Or you can find me at forgivennutritionist.com. This podcast was designed to educate, inspire, and empower you to achieve your health and wellness goals with your current healthcare provider. It is not meant to diagnose or treat any illness or medical condition or take the place of any treatments from your current healthcare providers.